Good morning, everyone. Sonia Liebendorfer here. I just wanted to talk to you today about high blood pressure. Before I do that, I have to give two shouts out to some people. Dr. Clarity, who took care of Sugar Bear and took care of euthanizing him for us. He sent us a beautiful card telling us that we were in his prayers and that the staff will miss seeing him come into the office because he was always such a delight to take care of. I'm grateful for that. And also, I want to give a shout out to Project Veritas for their well wishes concerning my mother. She is doing better. Thank you very much. Without further ado, let's go ahead and get started. We're going to be talking about high blood pressure today. We're going to be talking about how to take care of it. We're going to talk about the causes of it. We're going to talk about the harmful effects of it. So without further ado, let's get started. Okay, so the doctor has told you that you have high blood pressure and you want to know what that means. Well, it basically means that it's taking a greater amount of force to get the blood in your body to where it needs to go. And what happens with that is it means the heart is having to work harder to get the nutrients to the cells and to get oxygen to the cells and to get the waste products from the use of the food in the cells and get it eliminated through the kidneys and through the gut. There are many causes for high blood pressure. There are some factors that you can change, and then there's others that you cannot change. And we're going to be going into those because the things that you can change are the things that you really need to focus on. So let's first talk about what you can't change, because that's one of those things that is just a given that you have to be careful with. All right, the only thing that you really can't change when it comes to high blood pressure is your genetics. You know, if you have a family history of high blood pressure, chances are you're going to be getting it too. But all you can really do is control the factors that cause it to try to minimize your risk. But genetics and your parents and your families are the only thing that you can't control when it comes to getting high blood pressure, otherwise known as hypertension. All right, now let's talk about some of the things that you can change. You can definitely change your diet. If you have a lot of salt in your diet, you might not even realize how much salt that you eat. Start paying attention to the labels of stuff that you eat because you might find there's a lot of hidden salt in there that you didn't know about. My greatest example of that is one of the things I used to always love and still do love, but I can't eat as much of it as I would like, is chili. Loved chili. Was always eating cans of chili when I was growing up. Never really paid attention to how much salt was in it. The next time you pick up a can of chili, look at the salt content on it because I was floored. 2,400 milligrams of salt in that one can of chili. That kind of blew me away. Didn't really pay attention to salt content until NSAIDs such as Aleve, ibuprofen, non-steroidal inflammatory medications cause high blood pressure. They're hard on the kidneys. Anything that causes your kidneys to go awry is going to make your blood pressure go through the roof. So just be mindful of that pain control agents can cause it as well. Better to use Tylenol than to use Aleve or ibuprofen. I've seen people end up on dialysis very early from taking too many ibuprofen or too many Aleve. They're nothing to mess around with. Of course, if you take too much Tylenol, it's not a good thing either because it's very toxic to the liver. But as long as you don't take more than 4,000 milligrams of Tylenol a day, you're okay. Don't take it all at once either. All right. Number 2, make sure you control the amount of sugar in your diet. There's actually a direct correlation between high blood sugars and high blood pressure. High blood pressure always follows high blood sugar. Now, why would that be? Well, if you think about it, if your blood sugar is high, it's more viscosity and thickness of the blood, so it's harder to push through. So, whenever you have high blood sugars, you're going to have high blood pressure. It always follows. Also, look at the amount of fried food you have in your diet, because all those fried foods, all that batter has a lot of salt in it. Not only that, but high cholesterol diet can also raise your blood pressure, because as that cholesterol sticks to the vessel walls, then there's a narrower lumen, narrower area for it to get through. It's going to take more pressure to get blood through that narrowed lumen because of the cholesterol stuck to the side walls. So think about that when you're dealing with high blood pressure, what all it causes, what all it changes. And if you drink a lot of alcohol, even in moderation, you might want to consider reducing it. There's another type of high blood pressure called portal hypertension. And portal hypertension is caused by problems with the liver. It can make the blood pressure go up if you have issues with your liver. So these are all things to take into consideration. And it's important that you make the dietary changes now that you need to, because once this really gets a hold of you, it's going to affect the way you feel. You're going to get tired very easily. You're not going to have very much stamina. You will get to where that you have to take medication for it, that supplements that I talk about a little bit later will get to where they don't work as effectively for you anymore. So it is important to make the changes that you need to now to keep from having problems later on and get to where that you don't have the quality of life that you are deserving of because of changes not being made. All right, well, why do I need to worry about my blood pressure? Why is it such a big deal? First of all, the risk of heart attack. Second of all, the risk of stroke. Third of all, the risk of aneurysm. And if you're a guy, fourth of all, it can mean an inability to get or maintain an erection. Now, I know out of that entire list, the fourth one is the most important to you males. But the other three are worthy of consideration too. All right, controlling high blood pressure. Why does it matter to you? Well, as far as a risk for heart attack, it causes the heart muscle to fibrose or harden because of the increased pressure, which makes it less elastic, less flexible, and therefore there's more resistance to push the blood anywhere. This makes it difficult, and you will end up not having as much stamina to do the things that you want to do. You'll get tired more quickly because your heart is not as able to react in terms of expanding and contracting because the muscles are stiffer. And as far as risk of stroke, the stroke risk comes from the brittleness of the blood vessels in the brain. I want you to think of your blood vessels getting like bristles on a broom. what happens is those get so brittle that they break, causing a bleed into the brain. Depending on the size of that bleed and the severity, it can be fatal. If it's a smaller bleed, then they normally just put in a bolt into the brain and monitor it through ICP, intracranial pressure, because the brain's pressure can't get above a certain amount or it can cause death. So we have to keep those numbers in certain parameters. If there is enough blood, they put in a drain and drain off the blood as needed, watching the intracranial pressure. If it gets too high, they will drain off the blood. Eventually, it'll clot. But if it is an arterial bleed versus a venous bleed, the chance of death is much higher. If it is an aneurysm, there is an increased risk of a weakened area of a blood vessel actually ballooning out and then rupturing. That normally happens right at where the aorta goes down into the thoracic chest and down into the abdomen. That's where the pressure is the greatest as it leaves the heart. So that's where there is a high propensity for rupture and ballooning. Also, there is a chance of that in the brain. There's an area of the brain called the circle of Willis that is prone to getting aneurysms that rupture. Some of these aneurysms can be congenital from birth. There are hereditary conditions in which these aneurysms are passed down through life, and most people don't know they have them until they have family members that die from a hemorrhagic stroke or something at a very young age in their early 30s or early 40s and have no medical history, and then they find out that, lo and behold, there was a ruptured aneurysm that caused the problem and caused the demise. Now, the other thing you need to be concerned about is impotence. If you're a male and you do not take care of your blood pressure problem, then you're going to have difficulty getting or maintaining an erection. Now, medications can cause this as well. And for that reason, a lot of men just quit taking the medicine. Not smart. You need to just have the medications changed if it's causing this problem. Don't just quit taking them, because you can end up having any of those problems that I mentioned above: heart attack, stroke, aneurysm, develop if you just stop taking a blood pressure medicine. And be mindful that there's a connection between dementia and uncontrolled high blood pressure, because the stress of the body dealing with blood pressure that's out of control for a long period of time has long-lasting ramifications on the body, to include the brain. So that is why it is so important to make sure that you take care of yourself, because there are long-lasting effects that are going to make you feel worse as you get older. You're going to feel like doing less and less. So let's take care of the problem now so you can get it under control and feel better and stay feeling better so you have a better quality of life. And hopefully that makes sense to you, because it's very important. Okay, let's talk about controlling your blood pressure without having to use medication. I always think it's best to use alternative supplements to medications whenever possible. Your goal is going to be to maintain your blood pressure below 140/90. And there's several over-the-counter supplements that you can use that can help you keep high blood pressure at bay. Make sure you check with your doctor before you start any supplement, especially if you're on other medicines, because you don't know how they're going to interact and you have to know about the interactions. Be smart about it. Check with your doctor first. The first one I want to talk about is magnesium oxide. You can take magnesium oxide 400 milligrams a day to help with your blood pressure. There is a direct correlation between magnesium and blood pressure. They have found this. So it is important that your body has the correct amount of magnesium in it. The best way to get it is the sustained release magnesium oxide, 400 milligrams a day, added to your vitamin regimen. Another thing that you can do, I would do these one at a time and see the effects. Garlic. You can take 3,000 milligrams of garlic a day. Now, most people don't take that much. I take that much, and I'll tell you why. Because it has the additive effect of being a blood thinner. Now, I have found that the 3,000 milligrams a day is a good dosage for me. If I take less than that, then I normally will have more problems with the viscosity of the blood being too thick. It works for me, so that is what I go with. You can just take 1,000 milligram a day if you prefer, but it probably will not have the cardioprotective effect that the 3,000 milligram a day does. The other thing I will recommend is hawthorn berry. It is a capsule that you can take 3 times a day. There is a brand that I use, Vitamin Shop makes, that it is 565 milligrams. You take it every 8 hours or so. Whenever you eat a meal, you take one. And it can also help to get your blood pressure under control. Now, if dietary changes and if over-the-counter supplements are not enough to keep your blood pressure under control, I hate to tell you, but you're going to have to go on blood pressure medicine, because you don't want this to snowball and end up causing other problems later down the line, because it does. And I know this firsthand, because back in 2008, whenever I had my back injury by a patient, and I started taking the ibuprofen around the clock, the doctors warned me then, if you don't stop taking all that ibuprofen, you're doing your kidneys in. You can't keep taking all that ibuprofen. I was in pain. I didn't care. Sure enough, the ramifications of that decision came later. Now I have to take blood pressure medicine because of the fact that I was hard on my kidneys taking all of the ibuprofen all those years ago for pain control. They finally operated on my back and finally fixed it, but still, I was on ibuprofen around the clock for months before they did fix it. A good 7 months before they fixed it. In addition to that, I had epidural shots in my back and other things for pain. And of course, the steroids also drive up your blood pressure. So between the two, I was very hard on my body trying to just deal with pain. And so realize that if you don't take care of the situation now, it's going to get worse. And as the condition worsens, so does the treatment. Because if you don't reverse it, you can end up with end stage renal failure and have to go on dialysis. So this is absolutely nothing to take lightly. Make sure if you have a blood pressure issue and it's new for you, that you start doing what you can now to make the changes so you don't have these long-term effects, because they're going to reduce your quality of life in the long run if you don't. All right, now we're going to go over some things that you need to do daily. All right, you're going to need to buy a blood pressure monitor, and you're going to need to check your blood pressure every day. You're going to need to check it about the same time so you have a consistent basis of how it's running. You have to make sure that you've been resting for about 15 minutes. You don't want to take it after you've been running around like a chicken with your head cut off, because it does affect how it's going to read. Now, pay attention as the days progress as to what makes it go up, what makes it go down. Keep a log, because you'll notice that certain foods and certain things that you do, whether stress or diet, makes it change and go up or go down if you change your diet for the better. Keep a log, because it's going to help you realize how much spicy foods trigger your blood pressure to go up. It's going to help you realize how much fried foods make your blood pressure go up. It's going to help you realize how much sugary foods make your blood pressure go up, and how much salt has an impact on your blood pressure. Some people are super sensitive to salt, and it just sends their blood pressure through the roof. So you have to be mindful of what is really the triggers for your blood pressure, because it can affect your mood and how you feel too. Now, if the supplements that I talked about don't control it, then you are going to need to go on medication. Don't be resistant about it. Just do whatever it is that you need to do to keep your health the way that it is, and not cause long-term problems for yourself by not taking care of it. And in the next slide, I'm going to show you about using a cuff that is the appropriate size for your arm to make sure that you get an accurate pressure. Don't use the wrist blood pressure cuffs and all that stuff, because the farther they are away from the heart, the less accurate they are, and you can't buy those numbers. So make sure that you're using one that goes on the arm, the upper arm, not the wrist. Very important. All right, now to check your blood pressure at home, first of all, you need to make sure you have the right size cuff. You see that marker, those two arrows down at the bottom that says range? The size of your arm has to go between those two markers when it circles your arm in order to get an accurate reading. If it falls outside that range, guess what? You're not going to get an accurate measurement. So make sure you use the right size cuff. The cuff has to be lined up with the brachial artery. It's on the medial aspect of the left upper arm. If the left upper arm can't be used, you can use the right arm. But be mindful, there's normally at least a 10 millimeter of mercury difference, sometimes 20, between the right arm and the left arm. Why? Because the left arm is closer to the heart. So the right arm's going to read higher. So just be mindful of that. It's got more distance to go. All right, in closing, I just want to say thank you so much for being here today. If you have any questions, please feel free to email me, and I will be more than happy to answer any questions that you have. Thank you so much for spending your time here with me today on my channel to learn about blood pressure. I'm very grateful for all of my subscribers. And if you are not a subscriber yet, please don't forget to hit the like button and subscribe. And make sure that you share this content with anybody that may find it useful, especially if they have a new diagnosis of high blood pressure, or they might not understand the long-term effects that having high blood pressure has, and the importance of getting those under control means how much better your quality of life is going to be further on down the line. So thank you so much for being here. I'm actually going to be doing another video here shortly. I am interested in finding out how many of you out there encountered a similar situation to what my mother was in with the long-term care facilities. So I will be doing a video on that very shortly because I want to hear from you guys. And if you have any stories and don't want to wait until I do that video, then please go ahead and contact me at RN for a Healthier You, and make sure that you get the information to me. Make sure you flag it in some kind of way to catch my attention in the subject line. Otherwise, I go delete crazy because I get so many emails. So make sure you put something like, this is the information you asked for, something along those lines, so I know not to just go delete crazy and delete everything, when it might be you trying to tell me about a story that I might be interested in covering. So please, if you have any stories like that out there, um, just to let you know, my mom was moved and she is much happier where she is now. Not being confined to a room all the time and being able to be out and mingle and see other people and spend time with other people and not being confined to a room. It's made a world of difference. So if you know of any other places like that that are keeping their residents inside of their rooms and not allowing them to interact, please let me know, because we need to put this kind of stuff to a stop, and we need to have these people interacting, because it makes all the difference in the world. So I'll be doing a video about that shortly. But you guys have a great weekend, and we'll talk soon. Bye.